Life Unrehearsed, brought to you by Lianas Senior Transition Support, specialists in downsizing and seniors residences.
Good afternoon. Welcome to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing, and the senior living industry.
And I'm Corrie Matt, clinical social worker and psychotherapist specializing in grief and loss.
Coming right up on the first half of today's show, attention deficit hyperactivity disorder affects many children. But did you realize that it affects adults as well? And many of these adults may not even be aware they have ADHD. We'll be addressing this very prevalent disorder, and we'll be hearing from a prominent specialist in the field who will be providing us with some valuable tips and advice on diagnosis and treatments. Corey, it's so relevant. Looking forward to hearing from this.
As am I. So after the 3:30 news, we're going to be also switching gears and talking about planning for the non-financial aspects of retirement. You know, you hear so many stories about people wanting to retire, but when it happens, they actually struggle with it. We'll be taking some time to look at those struggles and speaking with people who are experts in the field who can help us understand what to do better to prepare for retirement. And if you are retired, well, you're going to hear some helpful hints to make those golden years the best ever. That's all coming up after the 3:30 news.
Yeah, Corey, you and I are both looking forward to that.
Don't age me, Matt.
All right. You know, attention deficit hyperactivity disorder, ADHD, affects many children, and as we're about to hear, many adults as well. Corey, as you know, I have a 23-year-old daughter who was diagnosed with ADHD when she was very young, about 7 or 8 years old. So I'm very familiar with the challenges she faces, as well as the challenges faced by parents out there who are just trying their best to manage day-to-day life with children with ADHD. However, many of these children grow up. And what does it mean for the family? And now they're adults, so they may be struggling as adults with ADHD. And so it affects the family. It could affect even the spouses, their own children. So to help shed some light on this, we have Dr. Lily Hechtman on the line. Dr. Hechtman is a child, adolescent, and adult psychiatrist. She's the director of ADHD Psychiatry Services at the Montreal Children's Hospital, a professor of psychiatry and pediatrics, McGill University, and the director of their research division of child psychiatry. Dr. Hechtman, welcome to Life Unrehearsed.
Thank you.
Well, thank you for taking some time to be with us on such an important topic. First of all, let's back it up a bit and just give us a brief explanation of what is attention deficit hyperactivity disorder known as ADHD.
Okay. Well, this is a condition which is currently thought of as being a neurodevelopmental disorder, means that the brain is involved and it's seen early in development. And it is a condition that is characterized by three main groups of symptoms. The symptoms are inattention, hyperactivity, and impulsivity. And we all have some of those characteristics, but for people who have the diagnosis of attention deficit disorder, those characteristics are more pronounced, they're more extreme, and they are impairing in their functioning. Mm-hmm. So it's really key symptoms of inattention, hyperactivity, and impulsivity that significantly affect your functioning, which combine to give you that disorder.
That's such a clear and concise definition, and I think it will be very helpful to our listeners. I wanted to know I was curious about what the prevalence in children and adults is.
Well, it depends on who you read, but generally for children it's between 6 and 8% of the general school-age population is generally diagnosed with this condition. It varies a little bit from one country to another, but that's kind of a mean prevalence. Now, for adults, it's really decreases. So it's more like 4.4% for adults. And it's not so much that they don't have some of the symptoms, but they learn to cope with the symptoms. So the symptoms are no longer impairing. And as you recall, impairment is a key requirement to get the diagnosis.
Mm-hmm. You're listening to Life Unrehearsed with Matt and Corey, and that's Dr. Lily Hechtman on the line. And we're talking about ADHD, and you just heard about the prevalence. A little higher than I expected, Corey, 6 to 8% for children, and adults even higher than what I thought. I get asked quite a bit, is there a hereditary aspect to ADHD, doctor?
Yes, there definitely is. I think there are many hints that it's genetically inherited. I think the most compelling data comes from the difference between monozygotic twins. These are twins that are absolutely identical genetically versus dizygotic twins. So, for example, for monozygotic twins, the concordance rate, which means that where both twins have the condition, is about 80%. For dizygotic twins, where they're not genetically identical, that goes down to close to 40%. So they're much more prevalent in monozygotic twins, which really gives the hint that it is very genetically determined. And then if you look at, for example, 40 to 60% of parents who have ADHD will have a child with ADHD. And then if you have a child who has ADHD, 25% of these children will have a parent with ADHD. So there is a strong family history and genetic component to this condition.
And I imagine that it's not necessarily known until somebody's being diagnosed, and then there you go, and it's probably these major aha moments. So let me ask you, what are some of the signs and symptoms that we should be looking for?
Well, if the key characteristics are inattention, impulsivity, and hyperactivity, so the inattention can take many forms. People are easily distracted. They can't focus for long periods of time. They go from one activity to the other. And so it's not being able to really start something and finish it and not get distracted by a lot of things in between, to the extent where it impairs your functioning. I think we all get distracted from time to time, but it doesn't affect our functioning. So that is a sign of the inattention. The impulsivity can be really quite dangerous, particularly in adults, in that they can't wait for the light to turn, they run a red light, they have an accident, and they're injured and somebody else is injured. So that impulsivity to run the red light is an example of some of the more serious parts of adult impulsivity in this condition. Also quitting your job or running, leaving a relationship on impulse are all other signs of impulsivity in adults, which can be very damaging to the functioning of that person. And clearly hyperactivity is seen by their really inability to remain quiet and seated for an extended period of time. They get restless very quickly, and this is probably more seen in younger people and children. And the older people just kind of feel restless and perhaps are less overtly hyperactive, but they have that inner feeling of restlessness quite a lot.
That's Dr. Lily Hechtman. She's the Director of ADHD Psychiatry Services at the Montreal Children's Hospital, talking to us on Life on Rehearse. Matt and Corrie with you. You bring up some very, very good points, and when especially younger children, I relate this to my daughter as well, and if parents are worried about their children not doing well in school, a lot of the times they may have ADHD, and sometimes they may wait too long. So I'm very interested in how ADHD, Dr. Hechtman, how is it diagnosed and assessed?
Well, I think it probably needs to have a really good assessment in terms of it being correctly diagnosed, because a lot of situation will give you problems with attention as well as hyperactivity. So part of the work of making the diagnosis is to ensure that these symptoms are not due to other conditions. They're not due to, say, for example, to anxiety or depression or severe learning problems or some medical issues like hypo or hyperthyroidism or vision and hearing problems. So you need to rule out other causes for inattention and hyperactivity. I think that's the first thing. And then to really see what else the person has that is maybe complicating the ADHD diagnosis, because a lot of people with ADHD also have other problems as well as ADHD.
So, full disclosure, not only does my daughter have ADHD, but I was subsequently diagnosed with ADHD. So all of this is so relevant and resonates with me so much. And I remember when my daughter got the diagnosis and I explained to her what she went, oh, so that's what it is. Like there's a big relief almost that helps explain it. So I wanted to ask you, how important is early detection?
I think it's very important because you have some extremely bright people who have the diagnosis and are very significantly underachieving, and they become very disheartened by that and very discouraged by it and start thinking of themselves as being dumb or not able to do academic work, or their self-esteem suffers a great deal. And the earlier you get treatment, the earlier you begin to function better, the less toll it takes on your self-esteem.
Yeah, it makes a lot of sense. Dr. Hechtman, Director of ADHD Psychiatry Services at the Montreal Children's Hospital. Doctor, we do have to head out to traffic, but now we're talking diagnosis, assessment, and like you were saying, Corrie, there's a bit of relief once that is done, and there are ways to treat ADHD, and yes, medication is one of them, but that's not the only answer. And Doctor, when we come back from traffic, we're going to ask you some of the ways to treat ADHD. But first, let's head out to the CJD Traffic Center.
Life Unrehearsed, brought to you by Flora Lee Senior Residences. Always there for you. Safe, reassuring, and comforting. We call it home.
Welcome back to Life Unrehearsed. I'm Corrie Sirota, along with my co-host Matt Del Vecchio, and we are talking to ADHD specialist Dr. Lily Hechtman, who is the director of the ADHD Psychiatry Services at the Montreal Children's Hospital. Dr. Hechtman, what are, in fact, some ways, non-medication ways to treat ADHD?
Well, I'm glad you asked that because we have worked very hard on non-medication treatments for ADHD. We've done a few multimodal treatment studies. What that means is that we use a lot of different approaches almost at the same time. So parent training for the child, there's academic training, organizational skills, study skills. These are all skills that people with ADHD sometimes do not acquire, time management skills. So the medication does not teach you skills. We have a saying
True.
Which says, pills don't teach skills. So we have done, and we are currently also doing a cognitive behavior therapy program, which runs once a week in a group. During the pandemic, it's online, and that program is for adolescents with ADHD, and in that program, we do teach time management, organizational skills, study skills, even anger management skills. And we also address self-esteem issues. Mm-hmm. So these kinds of organization study skills, time management skills, are things people with ADHD need, and the pills don't give them that.
Dr. Hechtman, so glad you're mentioning that because there is this perception perhaps that we're over-subscribing medication, and there's no doubt about it, and even in my daughter's case, medication has helped out. She's gone through Ritalin and Concerta, and just on that note, we have to acknowledge that medication is perhaps part of the solution, but not the only solution. I'm glad to hear some of those non-medication skills. But do you think we are over-prescribing medication for ADHD?
Well, it's hard to say because it's such a prevalent condition. You can see why a lot of people would be treated with medication. But I think it's important to underline that if a person has had a really comprehensive evaluation, then they would benefit from the medication, but they may also need non-medication interventions in addition to the medication to really function well.
Just a quick question on the medication, and if you could kindly explain the difference. I think two of the more popular brands are Ritalin and Concerta. Just very quickly, what are the benefits of both, and I guess disadvantages of both?
Okay. Well, actually, both Ritalin and Concerta, the stimulant medications are really the most effective for the condition. And the stimulant medication are either methylphenidate-based, which are like Ritalin, or amphetamine-based, which are like things like Adderall XR or Vyvanse or Dexedrine. These are all stimulants. They're all very effective, and they are beneficial. Now, some of them are long-acting and some of them are short-acting. And the ones that you've mentioned, Ritalin is a short-acting medication. It doesn't last terribly long, whereas Concerta is a long-acting medication, which lasts about 10 to 12 hours. So you can get away with taking a medication once a day in the morning, and it covers that child or that adult for the good part of the day. We prefer the long-acting. That give better coverage, they're more compliant, and it really serves the patient better to be on one pill, long-acting for the day, versus several pills, short-acting, because the several pills give you more of a roller coaster effect.
That's true. That makes sense. You're listening to Life on Rehearse. I'm Corrie Sirota, along with Matt Del Vecchio, and we are talking to ADHD specialist Dr. Lily Hechtman, who's the director of the ADHD Psychiatry Services at the Montreal Children's Hospital. We've talked a lot about the children. I want to go back to the adults. ADHD in adults, I'm going to go on the assumption it's not necessarily all that bad. So can you comment on some of the potential positive aspects?
Yeah, I think people with ADHD, they're very curious. They explore very many different areas. They're quite spontaneous. Kids love to spend time with them because they go from one thing to another. They're always kept busy and entertained. And there's a certain enthusiasm in that process. So I think it's very beneficial. And some people have been extremely successful because they're full of ideas. They may not see these ideas to fruition, but if somebody else working with them can capitalize and do the legwork for these ideas, then they can be extremely successful.
It's so true. So many successful business people, great ideas, idea makers. They're driving it, but they need someone to actually execute it properly.
Execution. Right.
So no, good to hear. So there is hope, and not to be too discouraged if that's the case. I know there's a lot of listeners, Dr. Hechtman. You are giving out a lot of resources. You're meeting with families every single day. Could you share with us some of the more popular resources that parents can look for, either for themselves or for their children?
Okay. Well, there are parent groups, and one of them is PANDA, which is a parent group for parents with children who have ADHD. AKITA is another parent group, which is the Quebec Association for Parents with Children with Learning Disabilities, and they also have ADHD under their umbrella. And some of these parents groups actually do run intervention. They run parent training groups, they run social skills groups for the children. So they also are very knowledgeable about what the resources in the community are. So the parent groups are a good place to start.
I love the idea, and I'm so encouraged to hear that there are these resources out there. I just wanted to ask you, I have to believe there's potentially, unfortunately, the issue of shame when it comes to a child with a diagnosis. And how do you handle that with the parents or help support them?
I'm sorry, the issue of?
Shame, like feeling embarrassed that their child has this diagnosis.
Oh, the thing is this, we sometimes have really well-known, famous people who have ADHD and don't mind acknowledging it. And so, for example, the Olympic swimmer Michael Phelps had ADHD, and he was really advocating that people can be successful even with this diagnosis. So I think that really making them aware of really successful people who have the diagnosis, and making them aware that there are other people like them who also are struggling with it. And that's one of the reasons we do some of these interventions in groups. We have parent groups and we have child groups, and for adolescents, for example. And I think that the adolescents particularly enjoy the fact that they're not alone with this condition.
So true. And you brought up a very good point, Dr. Hechtman, that ADHD 20 years ago compared to now, it is a different ball game, both in terms of medication and treatment. But I think much more important, just like you're bringing up, Corrie, is the stigma of ADHD and the fact that it's out there a lot more. It's more accepted, and there are some great solutions. So that's very positive. And just the fact that having you on the air, Dr. Hechtman, to explain this will continue over time to make it less of shame, and it is real, and I could speak firsthand how difficult it is, but also that it is very, very manageable. Dr. Hechtman, thank you so much for coming on to Life on Rehearse. We really appreciate your time and input.
You're very welcome, and good luck to you, and good luck to your listeners.
All right, thanks so much. That's Dr. Lily Hechtman, who is the Director of ADHD Psychiatry Services at the Montreal Children's Hospital. And what do we have coming up next, Corrie?
Coming up on Life on Rehearse, we're going to be talking about planning for the non-financial aspects of retirement. Can't wait to have that discussion. We aren't old, Matt. No, we're not old. That's all coming up after the 3:30 CTV News Update.